When you're pregnant, is it okay to have Botox or filler treatment? This is a great question, and I do have a lot of patients who have come to see me for quite a few years. They get pregnant and then all of a sudden they are unable to have their treatment. Now, what I always say to patients is that there's been no clinical studies to suggest that you can't have Botox or dermal fillers. But that being said, there's been no clinical studies on pregnant women, so we don't know whether the Botox or filler will have any effect on the growing baby. So this is quite a controversial topic. In terms of what I advise my patients, I would advise them to, if they're pregnant or they're breastfeeding, then not have any Botox or filler treatment. And the reason for that is because there's been no clinical studies to show, the product has not been tested in pregnant ladies to determine whether it actually has any effect on the baby. Obviously there has been cases where Botox may have been injected into pregnant ladies unknowingly, so it may be in the first few weeks or the first month of their first trimester. However, there's not been any problems associated with the growing baby. That being said, with fillers, there's not really been any studies to show that there's been any ill effects with babies for mums who have been injected with the filler. In terms of the spread of the Botox, whether it goes in the bloodstream, whether it can have an effect on the milk or on an effect on the growing baby, when Botox is injected, it's injected into the muscle, into the targeted muscle. It takes between 5 to 10 minutes for the muscle to take it up, for the nerves to take it up. It doesn't really roam around in the bloodstream. However, like I said, it's controversial, so it's not something that I would advise my patients to have while they're pregnant. In terms of filler as well, it's fairly localized where we're injecting the filler. It's injected into specific points on the face, and again, very, very low risk of it diffusing or going into the bloodstream. However, with fillers, there are certain side effects or possible complications, however rare. So if the lady does get a complication, then sometimes the way that we manage certain complications is using antibiotics. It's having certain treatments following their initial filler treatment. So this might cause unwanted stress and pressure on the pregnant lady. And obviously certain antibiotics we wouldn't be able to use, or the pregnant lady wouldn't be able to actually take those antibiotics. And so any complications may not be able to be managed quite as effectively. So my advice would be hold off. I know it's difficult because especially some of my ladies who have been having Botox for quite some time, they love their results. They do need to take a pause over their pregnancy, and especially if they're breastfeeding as well. But they can just come back and have their treatment following their pregnancy.